So, ladies and gentlemen, good evening, and welcome to the Black Belt Academy of Surgical Skills. My name is David Regan. I'm a professor in the Medical Education, Research and Development Unit at the University of Malaya. I'm second dad with the IDO, but I'm still learning. There's a lot to it. And the idea is, with a cut, is that the sword has got to do the work for you. So when you bring it down fast and you put too much pressure on it, the sword bounces at the end. But the sword is actually 1.1 kilograms, this one. And I've got to bring it down such that it stops perfectly at the horizontal. It doesn't bounce. And there's a fist distance between the end of the sword and my belly button. So to do it properly, you've got to hold it properly and let the weight of the sword bring it down. And it's the momentum that does the work for you. And just before the bottom, one rings your hands inwards, holding it with the middle finger there and the two fingers there. And it's called a tenuchi. And what they're looking for in the ido, and this was not described to my basic sword skills in the UK, but is reinforced now. I'm working and studying at the Japan Club here in Malaysia. It's that these things count. Because to take your sword up from there, bring it down and stop it without a bounce, perfectly horizontal. The sword is curved from here to here, and between there and there should be horizontal with that, and no bounce at the end. And the sensei can see it from the end of the room. And what they want to see is control, not a big swipe, a lot of strength. What they want to see is control. And I interviewed his sensei on sword skills. And what he did is put a matchbox on a tabletop with two matches in front of him on a counter. And he took his sword down, straight down, and stopped between two matches without touching the matchbox. I've put two straws in a paper cup on a bookshelf in my office, and with a wooden sword, when I want a moment to think and deconstruct, I'm practicing my short strokes. You hear the difference there. If I do it properly, I should hear a twitter, a high-pitched sound out here. Whereas if I'm not doing it properly, you hear a whoosh starting here, which is part of the strength. But the twitter out here is what I should be hearing and part of accurate swordsmanship. Now, the other thing is, when we draw the sword horizontally, if I hold it there, it should be held such that a drop of water can run down my arm, across the blade and off the tip. And it should be held such the point, kisaki, is right in your face. Now, if it's there, that 2 centimeter difference between there, the point being in your face, and there is life and death. There, I leave you open to come down and strike. Whereas there is threatening at all times. Now, as I learn the art of drawing the sword, the more I reflect on how we teach basic surgical skills. And the more I reflect that as surgeons, we do not practice. We're not taught to practice. And our senseis are not looking out for these important and deliberate elements of wielding a blade or a scalpel. It's given me food for thought, and hence the Black Belt Academy of Surgical Skills. Even holding it in this position, the suba has got to be the same level as my mouth. The sword's got to be 45 degrees out. The wrist and forearm are in a straight line. And this is the most economical way of carrying the sword round, and is also in a threatening position. So every position with a sword, whether it's up above your head and it's one hand above your head or to the side, all of it comes with a rational explanation of why we need to do it that way. I'll put my sword down for a moment and reflect on what Lord Barclay Monaghan said. The scalpel is, indeed, an instrument of most precious use. In some hands, a royal sceptre, in others, a rude mattock. The perfect surgeon must have the heart of a lion and the hand of a lady, never the claws of a lion and the heart of a sheep. An operation is done quick enough when it is done right. Every movement should tell. Every action should achieve something. If a manipulation requires, it should be carried out and not half done or hesitantly done. It should be deliberate. It should be firm. It should be intentional and final. Infinite gentleness, scrupulous care, light handling, and purposeful, effective, quiet movements, which are no more than a caress, are all necessary if an operation is to be a work of an artist and not merely a hewer of flesh. The sensei, and we have an 8th Dan sensei joining us on Sunday for instruction, which I'm really looking forward to. I've practiced for 30 years. They are the absolute masters of drawing the sword. And today, despite robots, despite high-tech devices, every operation still begins with a scalpel, even if it's an 11 blade to make an incision in the skin for a port. It is the oldest instrument of our profession, and knife skills is not just about cutting. It's about judgment. And I do like the phrase used by the National Rifle Association in America, is the weight of responsibility is way beyond the weight of the rifle. In other words, you need to have the right information in every respect before you put the knife through the skin. Obviously, emergency is accepted. In that case, you're saving somebody's life, and it's a risk-balance equation. But in general, if you have any hesitancy whatsoever or any question about the condition of the patient, you do not operate. Simple as that. You can always do it on another day unless it is an emergency. In that respect, it's all about judgment. And then once you start using the knife, as we've reinforced in the Black Belt Academy, it's posture, economy of movement, respect of tissues. And that is why we have developed our Black Belt Academy. So from Neolithic flints to obsidian blades, which is volcanic rock, that is sharper than modern steel, through Bard Parker's interchangeable stainless steel blades, and Swan & Morton's blades now, and they're producing 1.3 million a day, to emerging Korean plasma scalpel that cuts and seals in a single step. I'm not so sure. The responsibility of the knife is evolving, but the principles remain constant. As with the sword, if you start swinging it hard, it bounces at the end. It's a bit like golf or cricket bat. You feel and let the instrument do the weight work for you. My katana is 1.1 kilos. So coming from a vertical, dropping it to a horizontal, the momentum carries the blade and does it for you. And it's the curved bit at the end, the boshi, or the manucci, the first 10 centimeters, that is the slicing element of this. What we're going to take you through this evening are a number of exercises that you can do at home to practice and refine your scalpel skills. But all of this, because the blades are very sharp, my Iaito is a training blade, but the Shiken is a sharp blade, and literally if you do not do it correctly, you could cut off your thumb. So, part and parcel of the Black Belt Academy is safety. And if there's any recklessness with blades or sharps, that's an automatic disqualification, no matter what level you are. And we start every session with a blade mounting and dismounting. So I'll take you over to the top and we'll describe. I reflect this evening, I don't have any 10 blades. And that does not matter, because it's not the size of the blade that counts, it's how you use it. I'm grateful to Adrian Glossop of Swan Morton, who supply me with blades, and I can share them with the trainees in the Black Belt Academy. And this is a 22 blade. And my first surgical instructor, Mr. William Walter Frederick Southwood, at the Royal United Hospital in Bath. He wore a waistcoat, morning suit trousers, and a black jacket with a watch pocket. He was a Zorro with a blade and could open up a redo abdomen and do a gastrectomy within half an hour by using the blade. David Britton, reflecting, and I was cutting, would walk between the two theatres saying, "Keep cutting, my boys, keep cutting." And when I became an SHO in Bath, they said, "You passed your primary FRCS, you know your anatomy, here is a blade, off you go." And that was training. The handle by Swan & Morton and this dimple is a patent. And what I didn't realize till recently is a rule on the other side to enable you to measure. Note the bevel fits there at 45 degrees, and it has this interesting wide bit and short bit, which narrow bit, which sits into this groove here, which my thumb moves along. My nail fits into that groove, and that's the groove that the blade is supposed to sit. So when putting on the blade, hold the blade with a Halstead or a hemostat on the blunt side and maximize the surface area of the Halstead or mosquito on the blade itself. Ensure that you got it the right way round, that the two edges match there. And then the blade stays still, point into the surface. Do not do this on the patient because sometimes you get an inadvertent movement and indeed you could stab yourself or stab the patient. The handle is insinuated, coming through the wide bit onto the end, and my left hand is moving, and it should slide on. Now, sometimes it's sticky, but there's one movement. I've pushed it on. To take it off, I lift the end off, slide it off partially, reapply the halstead over the blunt end, and withdraw the blade. My left hand has stayed steady all the time with the point pointing into the surface. There you go, try that again. And take it off. And we expect this to be done safely each and every time by every trainee in every grading every time. And once you pass orange belt, if you can't do that properly, I'm sorry, that is a fail. The difficulty with our new sets of instruments, that groove that I ran my fingernail through is sometimes a little sticky. Be patient, that will wear down with use, as it is here. So the next thing is how do we cut straight? And we'll come back a little bit and going to use a model to demonstrate a fundamental flaw if you're not aware of draping and incisions and alignment. Now, when putting your drapes on, Christopher Lincoln used to say, you can tell how good a surgeon is by how well they drape. And he wanted his drapes on perfectly and neat and tidy. The saying goes, tidy ships. Thing is, you put your drapes on, and if you haven't put them on yourself and haven't thought about it, what could happen if you put a plastic drape across and pull it from side to side? You will pull the tissues across that side as well, and therefore distort any alignment. So when putting a plastic drape on, please put it down from head to toe and make sure it's come down evenly and you're not pulling the soft tissues, which would distort. So if I'm going to say we need to make an incision, all incisions are made according to bony landmarks. But the problem is, when you've got nice parallel lines here, you might think, wonderful, I'm going to make an incision parallel to those edges. And when you take the drapes away, all of a sudden you realize that you've forgotten the bony landmarks. So draping is an important element of operating, because if I straighten this out, you'll see that that line is skewed. So incisions and planning of most incisions is related to bony landmarks. And this whiteboard is giving me bony landmarks, and that incision is skewed. What we want in the Black Belt Academy is somebody to be able to do a 5 centimeter incision, 10 centimeter incision, even 20 centimeter incision. Now, I know this might be old-fashioned, but it's control of the blade. And what happens is that people can easily do 5 centimeters. 10 centimeters, they start to turn. And at 20 centimeters, without abducting the arm, we end up with a curve. And for cardiac surgery, a 22 centimeter incision down the sternum could look like that. I called it a Yorker in cricketing terms, and it's not perfectly straight because you've twisted around the hip. So those are two important things to be aware of. Surprisingly, this evening, I do not have any bananas. I do not have any bananas at all, which is unusual. But on the other hand, I've had so many bananas in the fruit bowl after every session. Perhaps it's a good thing that I don't have a banana. But for any organic material is useful. Now, I used to use pork belly, but of course, that is not culturally sensitive and not appropriate for most people in Malaysia. But a simple chicken leg with the skin across the top will suffice. And what I need to be able to do is an accurate incision for 10 centimeters. To enable you to do that, you need to examine, a bit like holding the katana, how we hold a blade. Now, the blade needs to be held in the palm of the hand. The sagittal plane between my thumb and my ring finger is maintained at 90 degrees. And you can see if I turn it slightly, the blade is not going to be 90 degrees. So I'm holding it 90 degrees to you, and you should not really see the blade. The pressure, the feel, is through my index finger. And my index finger is giving me direction and giving me proprioception as well. And that is how you hold it. The blade is 90 degrees all the way down, and you are supporting the tissue with your non-dominant hand. Just to have a look at this blade closely, what was interesting and Chris Caddy, my fellow sensei, has been around Sheffield. If you look at the blade on that side, one side of the blade is got grooves on it, and the other side is shiny. So if you look at that side, you can see almost like record grooves in the blade itself, whereas in that side, not shiny. And that is apparently deliberate, because if it was shiny on both sides and didn't have these grooves, it'll be too sharp and you would not be able to feel the blade. As you look at the color of the blade there and the shine as it goes through the angles, that is used by the ladies to look for any defect in the blade. So they're looking for a nice shine. Now, the cutting edge of the blade, a bit like the katana, that's the kasaki, the point, and it's the belly of the blade, the boshi or the monouchi, the first 10 centimeters of the katana that are used for cutting. So if that is cutting to a surface, I should ensure that the blade, the belly itself, is at 45 degrees to the surface, and I'm cutting with the belly. I'm not cutting with a point. I'm cutting with the belly. So the whole idea is holding your knife as I was holding the katana correctly, letting the weight of my forearm do the work, and I'm supporting the tissues. Note that if I don't, it's crinkling up. So I'm supporting the skin here, and I'm going to run my blade softly over the surface, supporting it all the way. And my finger is supporting the tissues, and I'm feeling it for the full length. Now, a chicken skin is extremely useful because to cut through a chicken skin, you need the lightest of touches. There you go. And I hope not to scratch the flesh underneath. A simple skill and test. We use the banana, and the banana is feeling through the skin and not cutting the banana flesh underneath. This is thin, but another example is to use an orange. We're going to come back to this in a moment. Is to use an orange. Now, with the orange, again, is to feel the blade to the skin. Now, I've used this just on the skin on the chicken, and many people would advocate now changing the blade as you're now inside, because this blade is theoretically dirty because you've gone through the skin. But just going through the skin, you'll find that has probably blunted the blade as well. How often do you change the blade? Whenever you feel that it's blunt. And gentlemen, when you shave, you want a nice sharp blade. And when I go to get beard trim at TrueFit in Surya KLCC, Elias and Mobeen are trained with razors, naked blades, and they learn by shaving foam off balloons. And if they cut the balloon, they're not qualified yet. You can imagine with cutthroat razors, you certainly don't want to be slicing the throat of your customers. And they are adept and practiced at using the blade. Funny that we don't practice the same on balloons. So I'm going to use the same blade for economy, really. And I'm going to feel this blade through the skin of this orange, all the way to the bottom. It's not requiring any force, and I've got to feel the blade through the skin into the end. I'm going to take it down this side as well, keeping it perpendicular, and feel the blade through the skin. And this is going to be a purple belt skill. So how do I know if I've hit the flesh? Well, there's a clean plate, and I'm going to squeeze this. And if I'd hit the flesh, you would see orange juice on the plate. There's no orange juice on the plate, but let's see if I excite this properly. Coming to the end. And there you got it. Now, different oranges have different textures and different feels and different thickness. And this is certainly thinner than oranges I've used previously. But what I want you to see, as I look down that, and as you look down that as well, I want to see that my cut has been perpendicular to the flesh. Yeah, you can see that the knife has been perpendicular to the flesh all the way. I'll squeeze it again to prove it to you. There you go. There is no juice there. Whereas if I cut it at all into the flesh and squeeze it, there I'm getting juice at the bottom. Okay? So I did not cut the flesh. But that's a useful thing to do. And try any fruit or vegetable you have in the supermarket or in the kitchen and learn to feel the blade. A common thing that is asked is remove a lesion. So let's create a lesion here on the skin. And we need to excise the lesion. Now, 11 blades are perfect for this. There, and they're held in a similar way. But when you hold it like that, it's very difficult to control the rotation of the blade if one's doing a fusiform incision or making an incision around a curve. The best blade, as shared with me by my fellow sensei, is this Baron blade, holding a 15 blade, and it works a bit like a pen. It's got that hexagonal pencil appearance. Good clearance ratio, that's 1:4. Along Langer's lines, remember Langer's lines, pick it up and see where you have excess tissue, and you can feel where the lines will sit. Langer was the anatomist who discovered this by using an ice pick on cadavers and noticing that some automatically closed and others stood open. And he mapped it for the whole body. So understanding Langer's lines will enable you to think about the orientation of the longitudinal axis of a fusiform excision. But what we want to do is excise this. You can start off with a point to make sure it's clean, good margin around. And remember that wounds heal from side to side and not end to end. And a good incision for primary closure is a perpendicular and clean all the way through. I'd use a skin hook to lift this off. You'd have an insistent, but here we go, lifting it off. And then with the skin hook, lift it up and remove this. And again, try this on an orange just to practice getting a clean, full thickness, end-to-end incision, ensuring again, as you look down at the edges, that it is 90 degrees. Have a cut the flesh, squeeze the juice, and there's no juice on the plate. But you can see now that ratio, pulling that together, particularly if we slightly undermine the edges, if it's appropriate, you can pull that together with interrupted stitches from the outside without tension, and you've got a nice linear closure. Again, the orange is fantastic to teach you to be 90 degrees to the tissues. Those incisions, but the blade is often used for dissecting planes. We described the scissors previously as being very useful working down small holes. But if you've got a large tissue plate, then using the blade is very useful. And in this situation, the blade is now moved from the palm of the hand across the base of the scissors, and I'm using the blade to brush the tissues away. But like that, I'm brush along the surface. But this time, if that's the tissue I'm removing, I'm brushing the blade against the tissue, keeping the sharp end at the junction between the plane I'm dissecting and the tissue underneath. And when you're working across a large surface, really and truly, you need an assistant to hold the edges up as you develop the plane. So what's interesting, as I'm using this bit of fish, I'm reflecting on the cooking programs that have frequently used fish, filleting, and boning of joints as a knife skills at the beginning. And it's interesting to see these aspiring chefs practicing their knife skills and looking at the facial expression of the judges as some of them are doing it. So what I want to be able to do is take the skin off, and again, this is where retraction and a second assistant is important, because I'll be working over a large broad area. And what I'd want is an assistant holding there and holding there to help me on this large area. But you see, I've got my blade parallel to the surface of the skin there. Let's come down and have a little closer look and focus in. My blade is sitting against the skin, and I'm literally using it as a brush. Now, if I'm holding it lightly, I can feel the condensation of tissue just there, which could be a vessel, but in this case, obviously, it's fibrous tissue. There you go. There you go. And what I'm going to do is translate this into the app as well and measure and look for damage of the flesh underneath and how much I've gone into the wrong layer there. You can see that. How much flesh is left on the skin. That's much better. It's just going over that fibrous layer there, and I'm going to use the full length of my forceps to try and give me that double-handed retraction that an assistant could possibly give me. This is where, in learning your knife skills, in dissecting, and when coming up to your black belt, the Black Belt Academy, we'll be asking you to demonstrate that you can instruct an assistant appropriately to hold this to make it easier. See, I can almost, I'm limited because I've got holding on one side. I'm going to perhaps help by using a bit of tissue on my thumb over a larger area, try and maintain that traction. You're letting the knife do the work for you. And you can play around with this model and see how, inverted commas, aggressive it can be to achieve the result. And therefore, playing with this model, you're learning to feel and appreciate how aggressive or how light you have to be. So there we go. What I want to see as we take this off is clean silver salmon tissue with very little, hopefully, in the way of damage to the flesh underneath. This is, to be honest, a two-handed assistant process because there I haven't got the appropriate retraction and now I'm getting into the tissues. So you do need assistant there, here and here to avoid that happening. But you get the idea. Be able to fillet the fish with your blade and take it off. So there we go. That is the salmon. That is the chicken. And for those of you who are concerned, they're not going to be wasted. They'll end up being used in cooking. Now, again, because of blade safety and taking blades off, I love this. This is also supplied by Swan Morton. It's my letterbox. And it takes the blade off safely. Wonderful. But I'm changing the blade because although I haven't done much cutting, I perceive it is blunt. And I'm going to replace it with another. Remember, the house head on the blunt side, pointing into the table, align and make sure you've got the right way round, and insinuate that over in the top into the groove, and it's just my left hand that is working, and it slides into position. So the black belt test is now feeling your way through the tissues. Now, this is a live demonstration, as usual. I cannot cheat. And you try it yourself. I've taken these sandwich meat. This is chicken sandwich meat. You can see that's rather thin process. I'm not going to talk about the nutritional value of this, but I'm interested in the consistency and the thickness. And I've got 10 or 12 slices there and sitting on a pita bread underneath. And what I want to do is learn to feel my blade through each layer without cutting the layer underneath. No cut underneath. So now I'm going to think to myself, well, there's one layer, there's two layers, that's the third layer. Is it possible for me to cut through two layers without cutting the one underneath? This is a bit like hold your breath and magic show. Okay, that's one. This is the second one. Okay, which I went through, but I certainly didn't. It went through. You can see it's cut through that side. So it's mostly cut there, but I certainly didn't cut the one underneath. And this is a fabulous exercise in practicing your feel. Remember, my left hand is supporting, and I'm now cutting one layer. There you go. Nothing underneath. So how many more layers I've got? Let's see, I've got 3 layers there. 1, 2, 3, and then a fourth layer. So there's 3 layers. So I've got to think to myself, what sort of pressure do I need to put through to cut through 3 layers? So let's see what I can do. Okay, that's 1. I've cut through 2, not the third layer. Okay, 1, 2, 2 more. So I didn't quite cut the third layer. Let's see, I've got 3 layers now against the bread underneath, and it's a pita bread. Let's see what we can do without cutting the pita bread underneath. One, two, and oh, you see, I'm awfully careful here. Most of the way through 3. There are 3 layers, and there's 1 layer left. So it's a totally unforgiving exercise, this. And we've put it there in the Black Belt Academy as a test of you being able to feel the blade. And I know Prof. Seeley has got a fantastic story to tell you on being able to feel the blade and appreciate the depth of the cut. The simple thing is, you don't need a fancy skills lab to practice these skills. Going to the Giant supermarket, Lawrence, who's the manager, often looks in the basket and says, Prof, he said, David, what are we operating on this evening? Well, I enjoy walking around the supermarket and imagining what I could use and the infinite possibilities that are available. Knife skills, a bit like the katana, have to be practiced. You can't just pick up a knife and keep cutting, my boys. You know your anatomy. That does not work. You have to hold the blade properly, align it properly, and learn to feel the blade through the tissues. And then the blade will start working for you. It doesn't require brute strength. It requires you to let the blade do the work and know when to stop. It's as simple as that. Or maybe it's not, but it does require practice. And interestingly, learning my katana, it strikes me that some of these things should be taught at the very basic beginner level. Because if you don't understand the why, you'll never actually be practicing properly. And if we don't correct the posture, the hold, the pickup, and the basics that we teach, you'll learn bad habits. And it's very, very, very difficult to unlearn bad habits. And in my own experience, I've had to unlearn the bad habits of the katana through 5 years of training in the UK and now 18 months in the Japan club. And I have no doubt on Sunday with the 8th Dan Sensei, I'm going to learn a lot more. The thing is, can you see it? And do you appreciate it? And has anybody ever pointed this out to you? So with that, I'll ask Prof. Sile to tell us her story and why understanding the feel of the knife in cesarean section is important. Prof. Sile. Prof. Sile, are you there? Yes, Prof. Sile is there. Not sure if we've got issues this evening, but any comments or questions from anybody online? Mr. Kelly, any observations or comments?
Mainly comments. Just to congratulate you. I really enjoyed the opening sequence of you wielding your katana. Um, and also listening to the sound that the katana made,
Mm-hmm.
because there was the whoosh and there was the twitter, and
Correct.
you explained the difference between the two.
Mm.
And I think in the UK, you'd be trying to make the whoosh the whole time, thinking that was the way to deliver it,
There's
where
no
it's
whooshing.
not. No, it's totally the feel of the blade as it moves through the air,
Correct.
and you wouldn't have been aware of that if it hadn't been pointed out to you.
Correct.
So up
Correct.
up until the point of time where it was pointed out, you thought you were doing a brilliant job,
Correct.
but you were doing a great job, but it could be better.
Correct.
And
Correct.
it's only by having that interaction with the sensei that you realize what you were doing well and what you were not doing quite so well.
Correct. And I do recall when I first started at the Japan club, he wanted me to show him Nukitsuke. Nukitsuke is drawing the blade as a horizontal cut and stopping as I showed you with the blade, pointing in your face. Okay. Now, I was congratulated by the sensei in the UK because I was training at that stage with a bamboo sword for the ability to take the sword out and go whoosh. Okay. And he thought that was fantastic. As one of the few people, he would say to actually go whoosh with my blade, bamboo blade. So I thought, Vincent was saying, show me Nukitsuke. So I thought, I'm going to do a whoosh. And I went, whoosh. And he went, which which was really funny because he literally put his head in his hands like this. And I thought, okay. Now, what's also interesting with the art of drawing the sword is that I only discovered this last week, is that when you pull the sword out the sire, I was told as it came out, it should be like a snapping twig. So I thought there was a sound involved. No. So I was doing the kids' game with Vincent there going, I was getting it out quite quick, but he said no. And I was looking at him and he said, no. He said, do you know what you're doing wrong? And I said, no. He said, I can hear the blade coming out the sire, which is a bamboo sheath. And he said, you'll break your sire if you do that. So in essence, The whole work of the sword is not the right hand drawing the sword. It's always the left hand, and you're pulling the sire off the sword. And as you take the sword out, you're pulling it right back. And at the end, your baby finger is running around your belt and pulling it back, and it's unsheathed and out of the sheath. Before you go that, then there's no sound at all. And he said, drawing the sword should be totally and utterly silent. And nobody had ever pointed that out before.
Once again, that's the point. Nobody pointed out to you.
Correct.
And much of what we're trying to teach within the Black Belt Academy of Surgical Skills, nobody points out, often because they're not aware of it themselves.
Correct.
And
Correct.
it's an iterative process. It gets better and better and better. And you keep practicing it until you can't get it wrong.
Correct. But then it comes back to until somebody points it out. Well, is there a list of this? And as I'm thinking of this,
no.
there isn't a list of this.
You're asking an almost rhetorical question.
No, there isn't a list. And if there was a list, it would be too much to digest and comprehend. So these refinements are really like a glass of champagne or fizzy water with the bubbles coming to the top. And as you focus on the basics, then you start realizing there are bubbles coming to the top, and they're revealing something more about your basic skill as you're doing it. So you're not building on skill, building up. What you're doing is digging deeper all the time, and understanding the essence of what it's all about. And this comes down to exactly what they say in martial arts. It is technique before power and speed. And it's important that the technique is correct, because if it's not, and you try and hurry, and you try and put force in it, the greater the mistake. And it's interesting that the senseis in grading have these katas, and they're looking for control all the time. And if you make a mistake, can you get control back? They don't mind if you make a little mistake, but does it upset your focus, your zanshin, and control? And that is the same in surgery. Yes, things sometimes are not quite right. Yes, you may make a mistake, but can you maintain your composure and continue with the same deliberate intent as you started out?
These are philosophical questions to which there is no easy answer. And each of us are on our journey. Some are earlier in their journey than others, but that's what time on this planet allows us to look back and see where we've come from.
Indeed, indeed. And it's interesting to be honest, being a student and learning, and then applying this thinking to something that I've been doing automatically as a consultant for 22 years. And it comes back to driving, as John Rund's taught, when you're driving a car, you're doing it automatically, but are you aware all the time? And it's what's interesting with advanced driving, that you're consciously conscious all the time, and you're always aware. Are we aware, operating? And when we're teaching, are we deconstructing, and are we consciously conscious? And are we making the tacit explicit? And I don't think we do.
No, you're asking open questions. So these are questions which each individual has to answer for themselves.
Correct.
And once again, they may not understand the question you're asking.
Correct.
It needs to be reframed in a different way. And that's one of the ways where your junior senseis who are actually in the dojo working with you will be able to see these problems, be asked the questions, and they have to come up with their own answers.
Correct.
Because they've worked out for themselves how to do it, but can they express that, and can they transfer that knowledge to their students?
Correct. And it's interesting that people learn in different ways. So what makes sense to you that moment would be, and you go, I've got it. Aha. You can see everybody looking around saying, huh? What they're talking about. So people appreciate different aspects and different metaphors and different angles of this. But unless you're actually practicing it yourself on low fidelity models that give you instant feedback, then you're not really working it out for yourself on what is there. And what's nice about Ken and Shavita and Adesh participating in this is on Friday we were playing around with the tangerine and taking out segments. And people look upon these models and think, oh yeah, until you try it yourself. And suddenly you realize there's a little bit more to it. And no matter how much I explain, you don't really know until you do. But you can't do it on patience. You can't say, you've got your primary FRCS, know your anatomy, off you go and cut. Keep cutting, my boys. No. Doing it on low fidelity models like this, you're now beginning to feel it and realize that there's a lot more to it.
So the other thing is when you cut through the chicken flesh at the left-hand end of the incision, it was slightly deeper than through the rest of it.
Correct.
So you actually scored the flesh itself and then
Yeah,
moved
well,
on
I'll
and
bring it
demonstrated.
back. We can have a
Yeah.
closer look at that. It was certainly. I'm not making an excuse.
No, no, no.
No, no, no. But your observations, I agree, are totally correct. It's there, but actually, if I
Yeah,
take the fat away, there's the fat. I've not cut the flesh. So there's
right.
a soft areolar tissue on the top that my knife went
That,
through. You see the pink stuff
that's
there?
that's the paniculus carnosus of the chicken,
Right, exactly.
which are the muscle
Exactly.
fibers
All
within
right.
the
But there's a muscle fiber underneath.
yeah.
I
Okay.
need to zoom in because I don't think you can quite
I
appreciate.
know you can see it,
Yeah. So
but
to be honest, your observation's correct, but on
yeah,
closer inspection, I'd say that's the pink stuff underneath the skin. Paniculus what? Carnosus.
carnosus.
Okay.
Yeah,
Underneath the skin, but I haven't touched the flesh.
yeah.
I haven't touched the muscle.
Well done.
But
You
your
got yourself out
observation,
of that one very
I,
cleverly.
yeah, yeah. Well, that's interesting because I didn't know. I've learned something. Paniculus carnosus, is that found everywhere on the body then?
No, no. If you look at horses and cows, they have muscle just underneath the skin, which they use
Okay.
to get rid of flies,
All
so
right.
they can flick the skin without contracting the muscle.
Oh, that's the yeah, yes. There you go, you see. Every
Yeah,
day's a learning day, isn't it?
every day is a school day. Yeah.
Every day is a school day. Paniculus carnosus, we'll put that in there as learning. Now, Prof. Sile, I was inviting you to tell us the story about sensitivity of the knife and cesarean section, because your previous story you have to repeat because I think it's so profound.
Uh, Good evening, Prof. Yeah. All right. I think I want to start it with the skin incision because you did mention that your skin is the skin incision and the skin suture is your signature.
Correct.
So yeah. All right. So those days we start cutting the skin. It's like the drape is like just like a normal drape that just now you demonstrated. So it's when we start cutting the skin, so it's like without plastic, so that we can go exactly where. Even with that, we already cover the anterior superior iliac spines from the both side, and then a symphysis pubic when you measure for that the exact phenostyle incision. Then sometime, especially in the obese patient, and then the line will not be like exactly what I want. So I start putting on with the marker pen. We have like plastic surgeon used the marker pen. So even with that, for the cesarean section, after we check the baby heartbeat, after this, we put spinal first, and then after that, cover the patient with the screen, so it's like, and then we check the baby heart, and then before we put it on, start cleaning and all that, I just, what you call it, mark on the penicillin incision exactly where I want. So now what I did, nowadays what I do is that the plastic, yeah, I 100% agree with you. The plastic sometimes like are very difficult to judge then. So I started with the putting a very nice exact line that what I want for the penicillin before clean.
Mm-hmm.
So that this mark must be very deep, mark, so that when you clean with the iodine, then it won't fade away. So that putting a line, draw it, then before even cleaning, so that when you drape with the plastic, and then you will get it exactly what we want. So this is still. In fact, sometimes we will have a 2 previous card, 3 previous card with the keloids. So it's like I already mark before I cut in the skin that where I want to exactly trim it off this the keloid. Yeah, so this is the first my input. The second one, the practice. So the students, if you don't have a knife, you can have a plastic knife, yeah, so sharp.
Mm-hmm.
And then I got this from Coffee Bean. Yeah, I'm advertising the Coffee Bean and tea leaf. So it's like they give us a set when you go for a lunch, and when you want to cut a sandwich, it's like from there you can start practice of, like this can be so a model to practice it. And I have a few things to show that the grape model.
Yeah.
And then you can trim off, only the skin, and then just not to touching it, the underneath the grape. Yeah, right, tissue. So, right. So this reflect our ovarian cystectomy. And you can also use the tomato, and then you can just cut it off, the skin. I still can use it, it's still sharp. So sometimes when you want to do an ovarian cystectomy, it's very thin like a plastic, you want to leave it this ovarian tissue. So once you got it, then if you have a McDonald in your theater, you can put it on with the McDonald. Can you see that?
Yes.
And just underneath it. So it's like once you get the plane, and then once you trim it, yes, no. And if you want to cut on that.
Nice.
All right. So
Yeah.
I just put it the McDonald, just advance a little bit more. Yeah, you still can get it. Just advance. No, this I took it out from the fridge, so a bit. Yeah. All right. Then you get it. Just cut on that. All right. So I use a 15 blade.
Yeah.
The tiniest one for the ovarian cystectomy. All right. So it's like we want to leave it the ovarian tissue as much as we can, so that the healthy one will come out, especially like endometriotic cyst. It's very stuck, the capsule. And in your pretest, then I read about this, your cutting with the diathermy. Yes.
Yeah.
So for the ovary, I don't use the diathermy because every bun, every heat can damage the ovarian follicles.
And to be honest, it's not just damaging the ovarian follicles. People often stretch the skin and then get the cutting diathermy to go through the rest.
Yes.
The amount of smoke and fulguration of the tissue and the heat transfer is absolutely appalling. And
yes,
I, as part of the tissue care bundle, used knife only from skin to sternum, because I read that there was a cardiac surgeon in Midwest America that halved his wound infection by using knife only to the sternum. And what's interesting at the end of then you attend to the little pinpoint bleeding rather than cooking of the tissue. Not only you reducing the smoke, which is carcinogenic, but actually when you look at the tissue at the end, it looks like fresh tissue as fresh meat in a butcher, rather than cauterized cremated tissue, which is not going to heal. And I worry about these heat transfer plasma scalpels. By definition, they're going to be transferring energy. And that's where cold steel, as in a blade, for the moment, has advantage. But you got another story, Prof. Sile.
Yeah. When you're dealing with the infundibulopelvic ligament, at the pelvic rim, so it's like the blood supply come directly from aorta to the ovary. And then the ovarian veins drain to inferior vena cava. So in that area, it is very near to your ureter. Yeah, they are very close. So when we want to tie this infundibulopelvic ligament, they call the ligament, but it is not a ligament. These are the vessels.
Yeah.
Yes, vessels, yeah, the gonadal vessels.
Yes.
So these gonadal vessels are very close next to the ureter. So if you want to tie it, just dissect it, only the vessels, and tie it, and then cut with either knife or your maximum Caesar.
Don't use the diathermy.
No, not at all.
Because you'll fry the ureter.
Yes, heat will transmit to the ureter.
Yeah.
So it's like, know the anatomy, choose the correct instrument, and then what you use, what are you going to cut, what structure you are going to cut, and then what instrument you will use, that is your decision.
So, and in an emergency cesarean, you're going through the abdominal wall, then you're going through the uterus, then you have to hit the amniotic sac. You've got to know your field, don't you?
Yes.
You feel the blade.
Yes, I feel the blade. Yeah, but it is like very thin.
Yeah.
Very thin. So it's like your judgment is very, important, right? Because not to, slash the baby underneath it.
You've seen that happen?
No, should not.
No.
Should not be happen.
Shouldn't happen. So if you're too vigorous with the blade, going through the uterus and the amniotic sac, and you don't appreciate the feel, you can slash the baby.
Yes, yeah.
I have not come across such a dramatic and profound example. So if you can't feel the blade, you're slashing the baby.
Huh?
Right. If that doesn't get you thinking, ladies and gentlemen, nothing will. And Prof. Sile always comes in with wonderful stories like this. Now, there's just one other thing I meant to actually point out, is holding an 11 blade, which is used for making incisions. And the very simple thing is, if you put your finger on the side of it, you can control the depth of your stab because your finger's there. So that's how much I want to stab through the skin. I can put my finger on the side of the blade and control my stab. If my finger wasn't there, my stab would be a lot further through the blade. So very simply, with an 11 blade, which is mainly used for stabbing, put your finger to the side of the blade, and that literally measuring the depth of the stab, and you can control your stab. Controlling the blade at every stage. Thank you very much, ladies and gentlemen, for your attention. Any questions from anybody in the audience or any observations?
David, may I
of course
say something?
Of course.
Well, the first thing is a question. Why do English countries drive on the left-hand side of the road?
Is that because people are predominantly right-handed and you've got to put your right hand out the window across the red side?
Well,
Good question.
partially. It's your sword hand is free
It's your sword hand is
because we're
free.
going back to, yeah,
Indeed, it is your
you
sword
can
hand
draw
being
your
free.
sword.
And that's why
To
the
get,
steps in castles are such that as you go up and down the step, your sword hand is free in the castle. And
yes, yes.
and 95% of people are right-handed.
And of course, my other observation relates to my skill, I suppose. Well, yes, in driving.
Mm-hmm.
And I'm talking now about, do you know how your clutch works?
Yes,
No, I'm not asking you. I'm just making it as a point. Because your clutch and your accelerator must work together.
correct.
So, in other words, if you're changing gear down, then you must increase the revs of the engine with your right foot. Well, yes, as you release the clutch. Because if you don't do that, you'll get a jolt.
Yes. But the other thing is with a clutch, and interesting, we're talking about teaching skills. The clutch is one of the pedals where you have to feel where
Yeah,
it bites and engages. You can't just take your foot off.
exactly.
And you have to realize
Exactly.
the pickup point of the clutch. And I was always thinking, well, if
Exactly.
you're teaching somebody to drive, this is gear shift. Many people have got automatics now, but is understanding where the clutch pickup point is. And you can hold the car steady on the clutch, but you'll probably burn the clutch out if you do it too much, which is interesting. It's understanding that.
Yeah, yeah.
Yeah, but also,
Yeah.
understanding the feel of the accelerator as well. You can't just slam your foot on and take it off.
Yeah,
It's
yeah.
gentle
And of course,
depression.
you're giving your if you've got passengers, you're giving them a nice ride
What's
because they're
all,
not being
yeah,
jolted all the time.
yeah, and what's
When
interesting with a car driving, you're listening to the engine sound,
yes,
and that's
yeah,
giving you feedback, a bit like the sword is wishing
exactly.
as well.
Yeah,
So you're using your senses all the time as part of this feel. And I suppose the feel
yeah.
is, listening, sight, and the feel in your hands as well. And
And thinking
it goes
ahead.
together. Yeah, indeed. Anyways, so ladies and gentlemen, thank you very much indeed. I think next week we're going to bring this all together with knife and scissors and bring it into a dissection again, one of my favorite elements, and describe the various elements of dissection, pulling these skills together. And with that, I'd like to thank iEcho, who enables us to reach across the globe. Thank you for your participation. Thank my senseis for their invaluable observations. And again, congratulate our fellow Sanshin, Dr. John Rudd, and I know Chris Caddy is going to meet up with him in a few days for a special occasion as we honor him as Sanshin for the Black Belt Academy. We wish you well, and good night, everybody.
Prof, I have to